I apologize that this is the first time I'm actually able to figure out how to get into the Ebright or Eventbrite. Like, I had a tough time figuring out for a little bit, but I'm here and hopefully I'll be able to participate in the events going forward.
We're super excited you're here.
Just the fact that you admit that you know Rico and you're connected with them, that's pretty brave stuff right there. So you'll fit right in.
Hey, I will say he and I've been with him for our Campfire and Ice since the first year in 2005, and we've obviously our camp's had its ups and downs, and this last year was up and down because we actually got McDreamy to zoom in with all the kids. So so we have a personal connection to McDreamy, and we actually got him to come to camp.
You're talking like the Grey's Anatomy actor, that actual dude?
Yeah, Patrick Dempsey. Yeah, he was at our camp this year.
Uh-oh. I'm panning all of the facial expressions on this call just to see the reactions from that. So that's pretty cool.
Madeline knows who that is.
Well, so one of our counselors actually trained Patrick Dempsey how to box for a movie.
Oh, wow.
And so he's friends with Patrick Dempsey. And Patrick's been trying to get out to our camp now for 3 years. However, because of shows and movies, has been unable to. But he was able to zoom in for camp this year. So it was a great. It stunk because we were hoping to not miss camp. We were hoping that COVID was going to be over and done with, and we were going to be the one camp that managed to squeak, because we had camp in 2020 just before COVID hit, May, and we were hoping to squeak it through, but we did not. So.
All right. Well, I think we're going to go ahead and get started then. I'm not sure. I think Chris and I were saying that we both are willing to talk today about what we're hoping to breach, which is our communicable disease plans when it comes to doing in-person camps. So whether you are doing camp this year or camp in the future, COVID is just one part of your communicable disease. You should have a communicable disease plan even outside of COVID. So even if you plan on doing a virtual camp this year, hopefully today's session will give you some education on how to just have a communicable disease, what should be included in it, and resources on how to get started. So I'm gonna let Kristen goes first because she's way smarter than I am and way better to look at and all those things. And I will just agree with her at the end of it and be like, yes, whatever Kristen says, yes, yes, yes. So I'm gonna let her be the brains of this, and then I'll follow up with anything that she might have missed, but I doubt she will miss anything.
I love, Daniel, that you kind of talk about that idea of communicable disease planning as really encompassing so much more than COVID, because pre-COVID, I didn't call my health and wellness planning a communicable disease plan. It was part of our policy manual. It's kind of our health and wellness planning. And we have all of these protocols and plans for so many different, from lice to bed bugs to bedwetting to, when somebody throws up, how many times do they throw up before you send them home? And, how do you separate kids out? Like, we have all of that planning, but COVID really pushed me to put it all into one place. And so every once in a while, I try to put some effort into finding the silver lining of COVID. And so that I think just that added organization has been one of them. A couple of years ago, is really part of my communicable disease plan, I added a suicide assessment process and intervention, and like a very structured protocol for camps. And we, so it's this constant evolving plan. So I hope everybody really thinks of your communicable disease plan as a living document that changes based on what we learn. So with that said, I'm going to focus a little bit more on the COVID aspect of my plan for this year. And Tim is going to screen share for me because I'm having technical difficulties on my end. So one of the things that I started out really thinking about is I started thinking about prevention at home. So what do we even need to do at home to make sure campers are coming to camp healthy? And then I broke that down into the different camp programs that we offer. We offer 5 different programs that are essentially residential programs at the University of Utah. And so each of those programs needed to be adapted a little bit differently to meet the COVID safety requirements. And so I looked at each camp program and thought about that from that pre-camp to during camp to even post-camp. And then we started doing a lot of research. I don't know how many of you guys are involved with the American Camp Nurses Association and the American Camping Association, but those 2 organizations offered like endless education and templates and information and webinars. And I just started having my team and I going to like everything we could find. And man, there's a lot out there that was really, really helpful. Ultimately, I'm going to be talking from a hospital camp-based perspective too, and Daniel will be talking a little bit more from a foundation perspective. Because then once I worked with my medical provider to really hone in our communicable disease plan, we then had to get approval from the university system to hold in-person programming. And for my hospital system, and I'm guessing everybody's is a little bit different, but we have like the main hospital, and then we have the School of Medicine, and then we have what we call lower campus because we're on a big hill, and lower campus is kind of the main campus. And so I had to have people from each of those 3 areas approve my planning. So that included on the main campus, I had to get approval from our Youth Protection Agency. So the University of Utah has this big organization called Youth Protection, and every single program that comes onto campus that has minors or hosts minors or even tours campus with minors has to go through the Youth Protection Agency to make sure they're really working within best practice in terms of youth and safety. And it's a prevention resource. And then I had to get approval through our incident management team on lower campus, who really were looking at my proposal through the eyes of every other, like the science team that comes to sleep in the dorms on campus, and the math group that comes for the Math Olympics, and Burn Camp is so different, but they kind of looked at it through those eyes. And then I had to have the Vice President of Internal Affairs look at my communicable disease plan and my per camp planning and give me some input. And then I had to have the Director of Infectious Disease look at it. And finally, I had to have my service line director. The burn center is part of the intensive care unit service line at the hospital. So I had to have the service line director, okay, my plan. So lots of eyes went on to this plan. And this is still what Tim has up is really, that's almost like just my brain dump of what do we need to do before camp? What do we need to do during and after each program? Tim, do you want to pull up the CDP? And we really looked at what was best practice from the perspective of, thanks, Tim, of offering therapeutic programming, hospital-based therapeutic programming to children. And that's different than, even, typical Girl Scout camp or Boy Scout camp or science fair camp. We have a very different mission than those programs. And so that was one of the things that I really stressed to my leaders was how this is different. So my communicable disease plan actually starts with this paragraph, sort of explaining that a little bit more. Do you mind scrolling down, Tim? Can I control this now? No. Okay, so this is my per camp proposal. You guys, I'm sorry, I don't have access to this at home right now. It's a long story. But so this is my per camp proposal, which is different than my communicable disease plan. I don't know, Tim, if you're able to find the communicable disease plan. It's a different document.
Sorry, you want me to move back to the other one?
Well, the communicable disease plan, which is like the tables that are set up, it says CDP on it. Yeah. Sorry, since I can't move it up and down, I'm having a hard time seeing. Okay, so scroll down.
Mm-hmm.
Okay, yep, that's it. Some of the key things that we really looked at are, one, this idea came from the American Camping Association, was keeping campers in the vehicle until after we completed COVID testing. So we'll be doing rapid COVID tests for everybody coming to camp. And those we had to get through the health department, and we had to get something called a CLIA waiver. My PA that works with me at camp took care of that piece. But they were available free of charge through the health department. We just had to get this waiver, and there was quite a bit of paperwork to fill out. Some of the other little things that learning opportunities throughout the way, because we're a university, a state-run university, we were not allowed to require vaccinations of adults or adolescents over 16. We had to make sure we had the verbiage that vaccinations are strongly suggested, but we could not require vaccines. Whereas I think I have a friend who runs a camp for amputees through the Shriners in Utah, and their board of directors was telling him he couldn't hold camp unless he required vaccines. So kind of, there's some different approaches there, I think, depending on where your agency is from. Let's see, what are some other differences that we're asking people to not bring the whole family to check-in, just one person. We are doing a health check, a symptom check, 7 to 10 days pre-camp, and then 24 hours pre-camp. But we're also doing a follow-up after camp. So a week after camp, we're going to call everybody back and say, how are you feeling now? Have you had any symptoms come up? Because then we'll know what we need to do in terms of contact tracing. We are working in small groups. So instead of having those big activities where everybody's together and the older kids are mentoring the younger kids, and we've got this blend of ages this year, our activities, from check-in all the way through checkout are going to be more based on these pods, so cabin groups. We also had to divide our kids camp in half. And so because they felt like the full camp, the full 50 to 60 kids plus kilts plus staff was just too many people. So we're doing 2 shorter camps, which pros and cons to that. I would love to get everybody together for one big long camp, but we had to kind of work within the dates that we had set aside and that we have reserved at our camp facility. So we're breaking that down by ages. So we'll have the 6 to 9-year-olds, and then we'll have the 10 to 13-year-olds. Our adolescent program, the river company that we go with, limited the size even more than it normally is limited. So we were able to bring fewer adolescents than we normally can bring. Another interesting thing we're doing with the adolescent program is that had always been something where either every 3 or 4 kids pile into one tent, and then we have these big tarps, and the teenagers love just sleeping out under the stars, and then the adults sleep on a cot kind of right by where the teens are sleeping, but not in the tent with the teens, but like on a cot, and we have our own little cot tents that we sleep in. But this year we are actually providing individual tents for each person, so there will be no more co-sleeping in tents. And that's something that we will probably hang on to from here forward. So I think that's a change that will be a permanent change for us. I'm kind of rambling through this. What questions do people have so far? Has everybody gotten their CDP done?
My question is about the CLIA thing. Do you know if that is specific to your hospital or to Utah? Sorry, there's a lot of echo.
No, it's okay. That's a health department thing.
Okay.
And I think that's across all states. It's called a CLIA waiver. And that, it got pretty technical. Tim, have you guys worked on your CLIA waiver yet?
We haven't. I will say that I came from Colorado AIDS Project, an HIV testing organization, and we were required doing HIV testing to have one. And really, anybody can be representative. Like Kristen said, it's just a bunch of paperwork, but it's essentially a way for the state to know who's doing testing for what and where and how and who those contacts are. So in case there's an issue, they can, get back to who the people administering the tests were.
Awesome. And it also gave us some guidelines for, how to turn in test results. We have to have all of our test results turned in within 24 hours of testing, and the health department has to be updated to any positives. We are, telling kids if you have a positive, you can't stay at camp, which is a heartbreaking thought to even think about. One of the things that we will do is have all of the camp swag ready so that if we do have a camper who can't stay at camp, we will be able to give them the camp swag, which will include ways for them to participate and be engaged with camp virtually. So that's something we're still working on, some of those logistics, but I can't remember who brought up that idea, but it was a really good one. Yeah, so that the CLIA waiver is associated with testing, and that's something that's going to be important to look into. Some camps are having the health department just send a representative to camp and do the testing. So, I think there's different resources available with different state and county agencies, and it's worth looking into. It's also worth thinking about if you're going to have the same requirements for staff and volunteers that you do for campers. That's easy for staff that are up there full time, but how do you mitigate that for maybe volunteers who are coming up for the day? In thinking about what are you going to do about guest performers and all of the guest activities that we usually have at camp. It's important to have a plan for that, and even if that plan is we're going to put that on pause for this year. The other thing that we did some really fast problem solving on was a sick room or a space for people to go where they could be still with the rule of threes, but isolated from the rest of the camp if we needed to isolate somebody until their parents got there. So we kind of created a new space for that because that's really different than the nurses' room, the nurses' area that we've always had at camp. This is how do we move these kids or these adults who are exhibiting COVID symptoms? How do we move them away from everybody else, but keep them safe and comfortable and not feeling ostracized? So we did some pretty creative problem solving around that. We also, a change for us, sometimes kids get sick to their stomachs because they're overexcited, or it's the night before the last day of camp and they're having really big emotions, or maybe they, ate something that just didn't agree with them. So we've always had, a little bit of some wiggle room with, okay, your tummy's upset or you just threw up once. Let's have you, lay down in the nurses area, and we've got the two nurses who are going to sit with you, and we're going to give you a little bit of time to really start feeling better before we decide what the next steps are. And this year we had to be very deliberate about what that window looks like for us. And with COVID symptoms, it's going to be much, much shorter, and we're going to have to communicate that to parents well in advance. It's not been unusual for our population. I've called parents and said, they've thrown up 4 or 5 times. They seem to be feeling worse, not better. We've gotten them drinking some Gatorade. We've got them resting. We've got a fan on them, but they've got a fever. I think it's time for them to get picked up. And I've had parents say, yeah, I'll be there in a day or two, and we've kind of done some back and forth, but we've been kind of accommodating with things like that. And that's going to change this year. So that's a culture change that we're going to have to really communicate to parents well in advance. We're giving them 60 minutes plus drive time to get to camp. So, if they're coming from another state, that might be a longer period of time that they can have, but we're not gonna let them kind of take their time getting back to camp to pick kids up. But the CDP really just goes into a lot of detail about health screens throughout. Who do we communicate to? What are our resources? It is all in one document.
Kristen, what's the consequence, I guess, if the parent isn't there in time?
We will actually take kids to the hospital. That's our plan. And that will mean, you know, because we can't transport them in private vehicles, so that will mean having an ambulance come up, and it's a big consequence, but that's what we're leaning on this year. What are other people doing about that this year? That was one we spent a lot of time talking about.
We worked out with it won't start video. There we go. We worked out with our insurance provider. We were lucky. He just happened to know a medical transportation company. And so we're not telling our families this, but if we're giving them 12 hours because some people are coming from 4 or 5 hours away, and if they can't get there within 12 hours, like we will transport them home. And that was what our insurance provider said, that they didn't want any of our staff transporting sick campers. So
Right.
I put on the releases that all the parents sign, who knows if they actually read them, but highlighted MCBC will not transport COVID suspect staff or campers.
Mm-hmm.
So.
Yeah, all these things that we have to be really clear about this year. And the other thing I'm doing is I'm sharing this plan with families. I am being as transparent as I can be. Daniel, do you want to go through yours?
Perfect. Yeah, sounds good. I'll kind of go over highlights of what it looks like from the foundational side. So some of this is going to be very similar to what Kristen has already done. I'm also going to screen share. I'm a visual learner, so this is just how I worked. Like Kristen, I'm grateful for COVID for getting the structure for our communicable disease plan. I would say, like most burn camps, we have a good amount of volunteers that are in the medical field, in the fire service, and then anytime there has been an incident, or we call camp crud, where we have about 4 or 5 kids all of a sudden get camp crud at the same time, and we have to evaluate, is this actually something that's spreadable, or is this something just AC units or being at camp for so long and eating candy, or what is this right now? So I think it's really good for you to make those evaluations, and having the structure and having to put this together has been really informative for us, because it wasn't something in terms of documentation that we had, although because I think we are a foundation, we don't have as strong sometimes of a background in terms of a medical community like those who come from a hospital camp program. So it does look a little different. A lot of the same things that Kristen focused on are the things that we have. So for us, we just had a mission of what our communicable disease plan is, our prevention strategies, including screening. Screening was a huge thing for us, because that was something that we really didn't do ahead of time, besides the informal screening that we had asked within having a physician do and sign off on a physical for our campers. We really didn't do a good enough job when it came to our staff screening, as well as our camper screening when they came to camp. We really waited until they self-disclosed that they weren't feeling well. During camp protocols and what that looked like, as well as sanitation, what did training look like, was communication, what is intervention when there is an outbreak, and this is non-COVID, this is any communicable disease that could happen during camp. What is recovery and mitigation, solutions? Pretty much our first portion of our communicable disease plan talked about all these things and took about 5 or 6 pages. But what I'll do today is focus more on the amendment that we have for COVID and COVID-like symptoms. So obviously, following the same steps that I mentioned before, we talked about what our screening protocol was going to be. And for us at the Elise Ann Rushburn Foundation at Champ Camp, we really wanted to focus on what did we find to be acceptable in hosting a camp. So we are going with a mandatory 72-hour negative COVID test before they show up to camp. So they must submit, just like if you go to an airline and you travel. So if you go to Hawaii right now, if you travel to Hawaii, you must show a negative symptom test to the airlines, or they will make you go into a mandatory quarantine. So for us, we wanted all of our campers and all of our staff to go through a negative COVID test 72 hours prior to coming to the camp, as well as they will be providing this. And this is one of the big enhancements that we did. We have been wanting to move over to a medical database system for a while, and we had one. We just had to do a lot of work in getting our applications and getting it going. If anyone's not familiar, Camp Docs is amazing. I know Kristen uses this and there's other camps who use it, but Camp Docs is amazing. And I think regarding COVID, it has been one of my lifesavers, as they have pre-screening tools available in the database. So there are going to be questions at check-in after we do a temperature check, very similar to what Kristen had said in terms of having the campers stay in the car, having the parents get in the car, do a temperature check. We are also doing a rapid test on site. So that's the second test that they will go through to learn, and then we will fill out the questionnaire. Have you had any COVID-like symptoms? Have you been exposed to anyone who had COVID? Do you have any of these check marks? And once we do that pre-screening, which we're able to put into Camp Docs, which because then goes into a database, we're able to hold that just in case if there is exposure, we can show proof that we did our due diligence in asking those screening questions ahead of time.
Daniel, can I say something real quick about the Camp Doc pre-screening feature?
Sure. Yeah.
We use that for our Changing Times Young Adult Retreat. Camp Doc also has the capability to send a text to everyone who is registered. And then the camp nurse and I looked at the responses the day before the retreat, and there were some people who indicated that they had been exposed to COVID. So we followed up with a phone call. We had them take a test, and then they had to show a negative test before we let them come to the retreat. One person couldn't show a negative test, so we had to be like, you can't come, and he was fine with it. But it was very helpful. Feedback from it was that it was not too hard. Some people were like, you're doing too much, and I was like, I don't care. So it was really, I felt better at the time of the retreat. I was not vaccinated, so I felt better knowing that people were at least paying attention to who they were spending time with, what their symptoms were before they came to the program.
Yeah, exactly. And I think another thing to add is this is something that cannot be regulated, but something we're definitely suggesting and encouraging is at minimum a 10-day quarantine for all of our staff and all of our campers. Obviously, I can't validate that. Obviously, getting to camp and all those things are going to look a little different in terms of who they may be exposed to. But I think just by suggesting it and strongly encouraging people, it hopefully allows them to start to think about, okay, I'm going to camp. Maybe I shouldn't go to this large birthday party with all of my family and friends, right? Or just be a little more conscious of it. We definitely are stressing to everyone that will be coming to camp of like, hey, this is a big deal. We're taking a risk in doing this, and we don't want anyone to get sick, right? We also, like Kristen, are not mandating vaccines. It was a board decision. There were a lot of board members and a lot of people who wanted to mandate, as there seems to be a lot of companies that are actually now encouraging mandating vaccines or making it really pretty much impossible to work for them if you don't have a vaccine available. Unfortunately, within California, though, within our rollout and what we have seen, although anyone 16 and older can get access to a vaccine, actually being able to schedule an appointment has been really impossible. So we felt, because our camp is literally in less than 2 months from now, that we would not mandate it, because we could not secure that all our volunteers would be able to actually get the vaccine if they wanted it. I'm also very glad we didn't mandate it, as in California and within our camp, we have a pretty diverse pool of people, and there are people who feel very strongly on one way or the other regarding COVID and the issues regarding around COVID. Some additional things for us to take into it, besides the temperatures and the screening process, was just the ongoing, anytime someone identified themselves as not feeling well. One of the biggest things I learned through the American Camp Association, as well as the American Camp Nursing Association, was the difference between quarantine and isolation. And I think that was a huge key for me, right? So quarantine is for anyone who has been, has a positive COVID test, where isolation is going to be for anyone who is not feeling well and we do not know yet that they have it. We are very lucky at our camp and working. We started this program very early on back in December when we started advocating to have it in camp. And we've been in close communication with our county health guidelines and our county health office. We proposed our communicable disease plan to them as we wanted them to review it. And in doing so, they have agreed. And I really encourage you, if you have not started this process, to reach out to community health or your county health department right away, because we are actually in this Fresno County Department of Public Health, we are actually going to be operating under their umbrella. So they have generously donated all of the testing for our rapid tests for all of our counselors and campers when we initially get to camp, as well as given us or will give us a supply of tests to do if anyone has COVID-like symptoms or think that they may have been exposed to COVID during the process of camp. And they are going to be doing a training with our medical team in order for us to administer those tests and then be able to report back to them if we have anyone with a positive test. In addition to that, so we have an isolation room as well as quarantine rooms and a COVID plan for our medical team. We are doubling our medical staff for this year. So we will have a separate medical team that will deal with just COVID-like symptoms or people with COVID cases versus those who just have the boobies and hours and scrapes that go on. In addition to that, like Kristen, we are operating in cohorts or family groups. So we have limited our camp as well. We normally have about 150 campers at our children's camp. Because of COVID, we have reduced that because we are reducing the number of kids in a cabin. So normally we would have about 8 kids, 2 counselors, or 7 kids, 3 counselors. We're now reducing that ratio to 4 campers and 2 counselors. That is just so that we are not cramming into one space and that people have area to breathe. We are going a foot to head, so people's 2 heads are not right next to each other. We're also looking at filtration systems for the AC, for air purifiers for the rooms. But with that ratio, it meant that we had to cut our camp by 33%. So we're only doing a maximum of 100 kids this year for our camp, which is a huge loss for us. I will say, although we are moving forward with in-person camp, for those 50 remainder kids who are not coming to camp this year, some of these kids are going to self-identify themselves as not wanting to come. We are also, in addition to doing an in-person camp, we'll be also doing a virtual camp for those camp at the same time. So it is going to be a beast of a week for me and for our staff and for our team. But we believe in what is equitable for our campers. And we know that there's a tons of families who do not feel comfortable right now releasing their kids to it. And we are totally okay with that. So in addition to following CDC guidelines and the 2 tests and the screening processes and these family cohorts or family groups that we're describing are 2 to 3 cabins. So there will be 6 people in a cabin. So no more than 18 people would be considered a pod. The reason why we're doing pod strictly alone is for contact tracing. If there is one individual who is identified as a positive case, we can isolate, not quarantine, those campers in a room and segment until we get them all tested and find out that they're all negative. And we will evaluate them on an ongoing basis once we've identified that they've been exposed to a positive case. With your family groups, we are allowing them not to have to wear their mask all the time. So that is one benefit of being in your family pod. That allows them when they're eating together as a pod, when they are sleeping, or when they are doing outdoor activities, they will not be having to wear their mask. But we are enforcing that everyone wears a mask. So pods can exchange interactions with one another. Our golden rule, what we tell everyone is it is 15 minutes outside both people have to be masked at a social distance. And that will be in what the CDC guidelines, if you follow those parameters, your likelihood of catching COVID if someone is a positive case with those parameters in place is very, very, very low. So we're taking that chances with that. So we are enforcing the mask policy. Not all activities will require masks. And like, for example, water activities, doesn't make sense to have a kid wear a mask. When the kids are getting on a horse, they will wear a mask, but as they're riding the horse, they are free to take their mask off. If they're doing any physical activity, very strenuous activity, they will not be wearing a mask, as we want them to have ability to do it. The other thing I will say, we are giving them 7 different masks, so they will have a new mask every single day. And the mask will be color coordinated, so we know that it is a new mask that they are wearing on that particular day. Obviously, hygiene, spreading, sanitation is a huge thing. So hand sanitizer, we're providing our campers with fanny packs this year, and they will have their own personal hand sanitizer, as well. There will be hand washing stations and hand sanitizer all throughout camp and at every activity. Because we are only taking about 100 kids, that means we're only taking 50 counselors. When we opened up our application pool for our counselors, we had almost 80 people apply. That means that we're converting all of those additional counselors to what we define as logistical staff, and they are going to be part of our sanitation crew. In addition to hand washing stations and cleaning and soaping and people cleaning the seats and bathroom areas, we also were given very generous donation of a fob machine, which is a water salt solution in which will sanitize naturally and disinfect rooms. So they've used this in fire stations and other large areas. So every day when the campers leave their room, the logistical crew and our sanitation crew will come into the rooms and fob the room to disinfect them for any crud that may be there. Let the room air out for about 3 hours before the kids come back in for rest hour in mid-afternoon. A lot of other things, physical distancing, obviously something new. There's a lot of things that we are having to take out of camp. We're not having ins and outs. Once you come into camp, you stay at camp. You can't go down to town. We used to have a lot of trips down the mountain because we're about 45 minutes from our main facility where we can go to a Target, a Walmart, a food store. So we are not having any of those trips because we forgot whipped cream for the variety show, or we don't have enough toilet paper to play this game. No ins and outs, no outside guests. So this means media day. We would normally invite a bunch of media to come up and do interviews and meet our kids. They're not allowed to come this year. We normally would have a group called Wind and Fire, which is a bunch of firefighters who ride on motorcycles come in. We normally have our chili cook-off with all of our fire departments and all their families come through. None of that is available for this year, unfortunately. We will be modifying our VIP and our media to a virtual component, and we'll still have to figure that out and what that looks like moving forward. Some of our programs are also changing. So normally we would do a big camp activity midweek. We normally would do a dance, normally do a variety show. I'm telling them, we're not using the word cancel, we're modifying that. So I will not be having an indoor dance this year, but you best believe I'm going to take our large game field and I am going to get a spray can or tape or rope, and I'm going to do sections, and we're going to have the biggest, best outdoor dance party outside. And it's going to be a whole lot of fun, and we're just going to modify what we normally would do. Same thing with campfire. Our campfire is normally around this small little fire. What I might do is create multiple little fires in the safe capacities with fire pits around an area, and we can all gather in a bigger area and amplify whoever's speaking on a PA system so that we can all partake that way. I think there's just different ways that we can do it and what we normally would do. I've already talked about disinfecting and sanitation, outbreaks. If someone does have COVID symptoms, we are asking parents to come and get their kid. Our consequence if they don't come and get their kid, guess what? You are putting your kid, one, in their health at jeopardy, and two, you're putting their jeopardy of them not being allowed back at camp next year. And for many of our families and for many of our campers, that threat alone for them not being able to come back the following year is enough a threat for them to actually follow through in picking up their kid. We will not be transporting any sick kid once they are identified with a positive test. We do imagine there might be some false positives that go around. If there are some false positives, we will be holding them at camp. And after we administer a test, we'll wait a few hours and they'll administer a second test to make sure that there isn't a false positive, especially if they have no symptoms. That's a whole lot of information. Obviously, these are the sanitation guidelines and what are restrictions, mask requirements, and things for each of our activities that we're doing. I will say, just like Kristen, we've had to jump through hoops, even on a foundational end, not to the same degree as a hospital. There's a lot more red tape there, but even on a foundation, I had to go to my board and propose us to even do camp and what the options were. So these are some of the highlights that I've already talked about our communicable disease plan and our COVID endemic and what we planned. Part of what I had to do for my board is actually collect some data. So for our counselors, we had about 80 counselors respond. And I asked them, how many are more likely to come to in-person versus virtual? And I had to tell my board, if you make me go fully virtual, I'm losing about 27% of my staff. So if that's what you want, I can do it, but just know the engagement's not quite as much there. And then for the campers as well, I sent a pre-camp survey to all of my campers. We had about 70 responses, which was actually pretty high for an email response survey. And out of 70 of them, almost all of them but one child said they would come to an in-person camp. That one child, however, was a kid that we had not had at any of our camp programming before. So this family doesn't know us. They know that they want to come to camp, but they don't know who we are. So they said they wouldn't feel comfortable coming. And again, about 26% of our families said that they would not do an online program again. And I got a lot of great quotes. I had a section, and anyone's interested in doing a pre-camp survey, I'm happy to send over my Google form because that's what I utilize to do the survey. A lot of our parents had the same sentiment here, but it was like they may or may not participate in a virtual camp, but they're not going to be fully engaged. They're zoomed out, they're tired, and they're fed up for being online all the time. So this was a great proposal that I was able to share to my board. After talking to board, just like Kristen, I went to my insurance company and I said, hey, listen, these are all the things that we're doing for camp. Do we have your approval? Got approval from our insurance, got approval for our board, got approval from county health. I'm also a camp that operates in a camp. So I had to take this proposal then to our host camp and say, these are all the things we're doing. They handle sanitation. They also hand out our food. They handle some of our activity planning. So they had to agree to what I needed as a purchaser, as you will, or as the person paying them. So they agreed to everything. And then just most recently, we had on Wednesday a camp meeting with all our volunteers to walk them through the guidelines and what we're doing and tell them that we are good to go. We had about 70 staff show up to that call. We went through all of the CDC guidelines, gave them some highlights, and tell them what this is our year's theme and some of the things that we will be doing this year. So that was really eventful and helpful for us. I will say, and I know I've been talking a whole lot, so I'm going to stop and let you guys ask questions or just move on to something else. Unfortunately for my state, there are no, and if you don't know about this website, go to the ACA website and look up state opening guidelines for summer camps 2021. I'm going to show you this map really fast because it's helpful for me. This allows you whether or not you can do overnight or day camp programming, right? So anyone in red, unfortunately, you guys down here, you're not having camp. Over here, there's no guidance. So for me in California, I've been given no guidance on how I can safely operate camp, which is really frustrating. If you are in Washington or in Texas or some of these other dark green, you can go here and you can actually see what your state is requiring to have residential camp. If you're in this light green, that means your state had guidelines from last year that can carry over for this year until you get the 2021 guidelines. And that is applicable also for day camps. The other thing I will say, what made my communicable disease plan and process so much easier was utilizing a lot of other things. The first thing was the ACA field guide, and this was done by the mental health and engineering company. This had so much good information that helped me do a lot of my communicable disease plan and a lot of my functionality. If you need help finding that, I'm happy to find it and push it to you. The other thing is through the American Camp Nursing, this side on communicable disease in the camp setting was also a really good document for us to review and to go over and what it meant going forth. So 2 huge documents. I will also say I love this network of IABC. I had a chance to work with Kristen and to work with a few other camps and say, I will share with you. Can you share with me? Let's talk about what you're doing. Obviously, we are in different states. We're in different counties. We're different. She's in a hospital base. I'm in a foundation base. But just being able to have those conversations allowed us to really move forward in setting up our own game plan. I will say that now that our plan is done, it's all been approved by everyone at this point. We will be moving forward, and this document will be released to our families, and it will be released to our counselors. We do have a COVID waiver, a release of liability for everyone to fill out. We are requesting that they upload their negative tests onto our CampDoc system, and they have to sign off on all those. We are going to be launching in 2 weeks our first virtual town hall. And once the document is available to our families and they're able to read it, we will do a Q&A and go through all the questions that our families might have. And I'm going to stop talking now.
Daniel, that's just weak stuff, man. I mean, it doesn't sound like you've really been doing anything. And this is really an intervention. I didn't want to tell you this, but we love you and we're all here for you. And we just want to see you realize your full potential. I mean, that's all we're hoping for. So
I appreciate one day, Coop. One day when I grow up, I will be just like you. I promise.
That's amazing. I mean, and I'd like to say that a lot of the things that we're doing mirror what Kristen shared and what you shared as well, Daniel, but where there's just a lot of, I would love to have resources to both of those documents, if that's something you could email out to, the participants of this call, just so we can cannibalize, or we'd be more welcome to also do the same thing. Some things I'm just going to dive in the kind of the details for both of you guys or anyone else for those questions. So again, a lot of the things that you showed or you spoke about really hit home for us. One of the things that we're still considering, because we're potting too, everybody's got a different language, so that it's fun to kind of see the vernacular being used. When it comes to like eating in the dining hall and like even swimming, we won't do other than like potting as well. Because you talked about, of course, non-masking and things along those lines. And some of that's, we've constructed it on our end, and some of it's, and honestly, it's in concert with the host site as well. And if you haven't had a lot of robust conversations, like Daniel and Kristen have talked about, not only with your local health officials, but with the camp, because there are many cases, the host sites that we're going to, they're running like a 10-week summer camp, and the volume of kids is staggering. I mean, lots and lots and lots of kids. And so, had you had any conversations about like aquatics, or just focus on large group? Are you going to have any large group gatherings in any capacity? Will everybody even be in the dining hall at the same time?
Well, between our cabin pods, and we'll be sitting, we'll set the tables up per cabin. Usually we've tried to kind of mix it up, so kids at different cabins are sitting together and you get to know different people, and you might have the youngest cabin sitting with the oldest cabin, but we're just going to be sticking to cabin groups even for meals. And as much as possible, we're going to host meals outside, and eat outside. And yeah, there's some changes in that. I think our big dance party at the end, we're still problem solving how to do that differently. One other thing that I forgot to mention that we use an existing camp, but we don't use their staff. We just use the facility, and we kind of bring a big trailer in and we move in. And it's a Boy Scout camp, and it's maybe not the best maintained camp. So we spend an entire day before our camp already cleaning. Maybe, like sometimes they don't use the cabins all year, they sleep out. And so we get there and there's like dead animals in the cabin, it's like a whole thing to clean. Right. Those of you who use like nice, beautiful residential camps, that's with their staff. And like, I always have Colorado envy for that. But this year, we're actually partnering with a couple of those big disaster cleanup companies. And they're big sponsors of Burn Camp and partner a lot with firefighter causes. So a disaster company called UDK is going to come in with us and partner with our volunteers and staff the day before camp and really help clean and use the big disinfectant. We're going to, clean all the carpets in the lodge, and we're going to get everything super, super clean. And then in between my two sessions, a different disaster cleanup company is going to come in and deep clean again. So we're kind of using resources in a different way. And those companies in the past have always donated a lot of money to us. And then this year they're donating their resources in terms of manpower.
It's interesting you say that, because we, our camp we're very fortunate. It's very well maintained and very clean, but we have collaborative mostly donor-based relationships with restoration companies that'll even do like hospital serialization. And so
Mhm.
we've reached out to them to see, because the host site's going to do a much more robust turnaround than they normally would, but we're trying to delineate whether it's worth, like, how long would it take them to be in each cabin? Is it worth it to us?
Yeah.
But their level of cleaning is going to be, I mean, on another level, so to speak. So, and even with the town, I guess it's just so I'm not cannibalizing people's time with my questions. Like Daniel, you talked about town run folks. So we're going to minimize, kind of town run as well. So, if someone needs 10 cans of silly string, that's not going to be a necessary item versus if we needed it, heaven forbid, another lice kit or something along those lines. Do you have a protocol for them? Because it sounded like you're not having anyone come in your bubble. Once you establish your bubble is established. So the only complications, and I feel like we're very similar in those regards. The only way our bubble will be compromised is if we have people from the campsite cooking food for us, or lifeguarding, or anything along those lines, or if we leave the bubble. We've identified one logistical person that's going to be doing the town runs, but we haven't really adapted what the protocol will be when they come back in. Is it just going to be like a simple temperature check, or what's the, have you guys thought that far on what you would do when they re-enter?
So we're not allowing town runs. We're not doing any of
none
that.
at all.
And yeah, none at all. You gotta love technology, and I love Amazon. Amazon does a 2-hour delivery for any food produce, and we're so close to a 45-minute for the major town, is that they will deliver to our camp facility if it's a food item through HelloFresh, and we can get that delivered within 2 hours. Otherwise, it's a 2-day turnaround. So if you get to camp and you realize you don't have something, hey, and I think the bigger thing is we're all camp people. We adapt, right? So if we need something urgently, we do have people who live locally, and we are partnering with our fire department, and we have a contact with the fire department that we will send the fire department in town to come bring us something when they're off duty, drop it at the gate of the camp, and we have no exchange with them, and we pick it up like it was a package that was delivered to us. But we're being very, very, very strict on no interaction outside bubble. We do work within a camp and a camp, so there are people from that facility who are going to be there, but we're even bringing our own lifeguards because we don't want lifeguards coming in and out. So we're bringing in housing our lifeguards for this year, which is additional housing that we have to think about, additional people we have to think about, additional COVID tests that we have to do. But that's just the precaution we're taking. Obviously, if my state comes out with guidelines for camping that is way less restrict, and we went the strictest we can with this, because I had to get it through my board, I had to get through all these levels, and I was like, I'm just going to do whatever I have to do just to have in-person camp. I need in-person camp this year. I'm not going to last if there's not camp this year. And because of that, if those guidelines are released and they're not to the level that we are, guess what? I'm gonna follow the state. I don't care what I put together. I will modify it so it's to those state guidelines, and I will augment it. But the other thing I will say is a lot of my board came back to me and said, oh, this is great. We have no issue with this. The one thing we have concern is it just takes one kid to go home and have COVID and give it to their grandparent, who is their only provider, who is their guardian. They lose that grandparent due to COVID, and now they have no one, and we've done a disservice to that family. And I was like, totally get it. I'm feeling you're giving me the worst case scenario right now of them only having their one grandparent, but I do know that that's available. I said, I will do you a solid then. I will do a third COVID test as they are leaving the camp facility to make sure when they leave RRS that they have a negative COVID test. I said, because at that point, if they've done a negative COVID test 3 days prior to camp, they've been with me 7 days, and they do a test on the last day, that's 10 days. So after that point, I can say pretty much for certainty, to a degree, that they did not contract COVID at camp.
Right. It's interesting. Yeah, we're doing the 72-hour PCR in advance. We're actually going to do the PCR again as opposed to rapid, because the rapid sometimes isn't as reliable. The turnaround in Indiana is fast now. It used to be like a week, 2 weeks, but our state is so fast in being vaccinated that the lab time for PCRs is nothing anymore. Like we think we'll get it back 2-3 hours after we get it administered. So that's interesting, doing one at the tail end. I hadn't really thought of that. I'll hang up and listen now. I've talked enough.
Oh, go ahead.
I was just going to say, I had a question for Daniel about the whole fogging or sanitizing the cabins and how you were explaining that. I recently went through a designated infectious control officer course with one of the country's leading, Catherine West, leading infectious control officer or infectious control people. And she was even stating how us as fire departments, I work in a fire department, I walked around the beginning of COVID, deconning the back of ambulances with atomizers and this, that, and the other thing. And she was talking about how based on, COVID's a virus and it needs a host, and simply airing out and freshening out cabins. So I just was curious to know exactly kind of what's kind of led you down the atomizing path, because we're all starting to go away from that path and just simple, deep, like regular bleach type of Clorox wipes, that kind of thing, to kind of clean stuff out. Not that I'm second guessing anything you're doing, just a question of maybe what led you down that path.
You know what, for us, it was the fire department one of our fire departments nearby who said, we want to donate this to you. And it was an additional thing. So it's not saying that we're not going to be doing the wipe down of the Cloroxes and all that. And actually, really what it comes down to in the science of what we found out, simple hand washing with soap and water is the best thing you can do, even better than hand sanitizer, right? So as long as you're taking your own personal precautions related to your own hygiene and soap and water between the things you're touching, it's really going to mitigate all that. So it was just one additional level that we said, well, it doesn't hurt. And then we looked into the solution of what it is, and it's pretty much salt water soluble, which is proven to get rid of things. But honestly, it's also just opening up the windows, opening up the doors of the cabins, spraying something and letting it soak in there and heal anything that may still be in there. But it wasn't a hard press that the board was like, you must do this. It was just an additional thing that was donated. And I also know that we're past our time in what we normally mean. I don't have another meeting at this, but I know other people who do. So if you need to leave, feel free to leave. If you want to talk and ask questions amongst each other, I'm no expert. Kristen is way more of an expert than I am, but she'll even say she's not an expert. So we're all learning. We're all learning from each other. So if other people have lived experience regarding this, or other ideas that they've been doing, feel free to share. If you need to go, you're more than welcome to go. I will say two things. Just because it's come through my email poll the last couple of weeks. One, if your camp is not connected to Avita Medical, they just sent out a huge email to a bunch of burn camps saying, hey, we're giving headlamps, journals, and towels away. Come and get them. So if you did not get that email, put your email in the chat and I'll forward you the email, and I'm sure they would be happy to give it to you. The second one is Monalika. I'm not sure how many of you guys got Monalika's email. They're giving away, I think, backpacks and I think something else. She said it's like a whole kit when I talked to my rep. So if you don't have that connection, let me know. I only have the connection for my regional person, but I'm sure she can connect you to someone else. There you go. Coop has one right there. These are great free resources. I think they said maybe sunglasses or something. So free great resources. Again, put your email in the chat. Happy to send over those emails that got connected. Feel free to hang out here or talk if you have more questions.
And Daniel, Avita Medical says choose one.
Right.
Owl, headlamp, or diary and pen.
Well, we'll see what they give me then, because I said all of it. Thanks.
Perfect.
Man,
They're great.
One other thing too, coming from the education committee, our plan for May was to talk about mental health, but I'd like to just ask, based on this robust conversation, if maybe we want to talk a little bit more about planning, maybe the CDP stuff, but just in advance some of that. So I don't know if you guys, how you feel about that. I guess we could send out another email, or we can just think on that, Maddie. But I'm just wondering if some of these other things may feel a little bit, a little more concrete and pressing, but that's just something that we might want to consider.
Everybody, I've got to sign off, but thank you so much for this discussion. And boy, this group really sustained me through the past year. It was a tricky year, lots of learning curves, and being able to reach out and email people for thoughts. These monthly meetings, beginning they were weekly, so helpful. So thanks a lot to this whole group. This is about the year anniversary of our first Zoom meeting. So, or was it back in March? I don't remember, but we're around that year mark. So thank you all for helping me and my program to sustain for the year.
Thanks, Kristen.
Thank you. Everybody have a great weekend.
You too.
Bye.
So